My project is on pressure ulcers, and I'll start off with the healthy state. It is moisturized skin, no damage to any of the layers of skin, like scabs, and cuts that are infected, or anything like that. Stage 1 is the skin is not broken. The skin appears red on people with lighter skin, and the skin does not briefly lighten when touched. The site may be tender, painful, firm, soft, warm, or cool compared with the surrounding skin. Stage 2, the outer layer of skin and the part of the underlying skin is damaged or lost. The wound may be shallow and pinkish. The wound may also look like it's a blister. Stage 3, the loss of skin usually exposes some fat. The ulcer looks crater-like, and the bottom of the wound may also have some yellowish dead tissue. Stage 4, the wound may expose muscle, bone, or tendons, like right in here. The bottom of the wound will likely contain dead tissue that's yellowish or dark, crusty, right here. And for the diagnosis, I'll start with the definition. Pressure ulcers are also known as bed sores or pressure sores. They are injuries to the skin underlying tissue resulting from prolonged pressure on the skin. In my words, I'd say that if a person is being unattended to or not being, rolled over onto different parts of the body, they will get sores on the areas of the heels, ankles, hips, or the tailbone. Anatomy. This disease altered the body by making craters into the skin, kind of like deforming the body. Physiology. The infected skin takes nutrients from other parts of the body, like the other organs, to function properly. The immune system needs to be kept healthy so the person doesn't get sick from other things. And planning, part 1, is a CNA would be taking care of the cleaning of the wound. Like, they would be washing it, cleaning it with a washcloth with warm water and soap. They would be positioning a patient to reduce pressure on the ulcer and also to prevent other pressure ulcers. Planning 2, the patient might be worrying about surgery if needed, and the family might be grieving about the loss of a family member. The intervention is to treat the disease. You have to put great care into the patient. Cleaning of the sore, positioning the patient every 2 hours, and give the patient a healthy meal. The patient needs a healthy meal to get the nutrients and the minerals and the vitamins that the person needs. And in this program, we learned how to feed a resident, positioning a patient, and also transferring. If the resident is capable, you can use the transfer belt. And for positioning a patient, you would be using the log roll. And the evaluation. The goals are to help a patient be comfortable and in the process clean the infected area if stage is still at 2 or 1. I think that if the stage is not 3 or 4, they might need surgery, and CNAs don't have the ability to do so. Is it working? If the wound is starting to heal, the treatment is working. If it's clean and if it's scabbing over, and it doesn't look infected, it should be working. Stage 2 can very well go into stage 3, and if it does, the skin can start to expose fat and damage the layers of skin. This means it's not working. And I believe that is all that I have for my project. Thank you.